So a sign is something that you can see. So it's observable from the patient. And we'll talk about some examples of that. A symptom is something that the patient reports to you, such as I have a headache. You won't be able to see the patient's headache, but you might see the patient go unconscious. So that is a sign. Loss of consciousness is a sign. Headache would be a symptom. So that's kind of the difference between the two. So here are some signs of concussion injury. So I'm going to cover concussion first, and then I'm going to go into talking about the red flag issues afterwards. So, signs of a concussion. Loss of consciousness is a sign of concussion. It's very rare, though. Less than 10% of concussions actually result in a loss of consciousness. So, if somebody does not have a loss of consciousness, this does not mean that they don't have a concussion. Seizures, also very rare, but is a sign that there's potentially a concussion that has occurred. Having a blank or vacant stare, so sometimes you look at a patient after they've had a concussion on the sidelines of a sporting event and you're speaking to them and they're just kind of not seeing anything. They're just blankly staring off into space. Sign of a possible concussion. Delayed verbal or motor responses, so they're slow to answer questions, slow to follow instructions. Confusion, inability to focus their attention. Disorientation, like they pick up the ball and they go the wrong way. That's a sign that there's been a concussion possibly. Slurred speech, gross observable incoordination. So if they get up and they're stumbling and they're off balance, inability to walk in tandem. These are all signs, something that you as an observer can observe. So if you're watching TV and you see a football player get hit on the field and they get up and they're off balance, everyone at home can pretty much pick out that that's a sign of a possible concussion. That player should be removed and evaluated. Becoming emotional, sometimes people will just cry uncontrollably and it seems like there's no real reason behind it. And then memory deficit, so the inability to remember, certain words that you've provided them, or actually having true memory impairment where they don't remember the entire first half of the game. So that's more of the post-traumatic amnesia side of things. But those are signs that a concussion may have taken place. Okay? Separate that from the symptoms of a concussion. So there's 22 main symptoms that show up on the versions of the SCAT, which is the Sport Concussion Assessment Tool. Each of these 22 symptoms is typically rated from 0 to 6 by the athlete or the patient. The symptoms are headache, pressure in the head, neck pain, nauseousness or vomiting, dizziness, blurred vision, balance problems, sensitivity to light, sensitivity to noise, feeling slowed down, feeling of fogginess, not feeling right or not feeling like yourself, difficulty concentrating, difficulty remembering, fatigue or low energy, confusion, drowsiness, trouble falling asleep, more emotional, irritability, sadness, nervous, or anxious. So each one of these symptoms is generally asked to a person suspected of having a concussion, and we usually get them to rate each of these symptoms from 0 to 6 in terms of their severity. 6 is the worst they could ever possibly imagine. 0 is I'm currently not experiencing that symptom. So we go through the list, we ask them to rate each one of these. The problem with this list and relying on somebody to report their symptoms to you is that people might withhold this, right? They might not be so forthright with their symptoms, particularly if it's a sporting event and they want to get back in play. So that's where paying attention as a sideline medical personnel to the game and being able to see some of these signs and pick something up is very, very important to making your initial sideline diagnosis. Symptoms, you're relying on the person to report that. So that's a bit tougher.